Hello again, and welcome to Module 2 of the Understanding Depression mini-series. I'm proud of you for making it here. Today we'll talk about how depression is diagnosed to help you understand a bit more about what it looks like. Remember, this is for educational purposes only and is not a substitute for treatment. And just because I'm sharing how clinicians diagnose depression doesn't mean you can self-diagnose. If you're wondering if you have depression, you need to work with a professional to receive a diagnosis. So before we dive in, let's talk about the homework. How is cleaning your room or doing one chore every day? If you didn't do it, that's okay. Just write down how you felt about the homework. Take 1 minute to pause this video and write down your thoughts. Great job on the activity. If you'd like, you can leave a comment or send me an email about your experience. Now let's talk about today's topic. First, there are different types of depression. What they have in common is feeling sad, empty, or irritable, along with changes that make it hard to live your normal life. What we usually call depression is actually called major depressive disorder, sometimes MDD for short. This means that you have periods of feeling depressed with times of feeling better in between. You might feel depressed for a while, then feel okay, then feel depressed again. These episodes last at least 2 weeks and involve changes in how you act, think, and feel. These episodes are not just normal sadness or grief. They're more intense and have specific symptoms. The PHQ-9 questionnaire that you might have done, that quiz, helps us understand if you had a depressive episode. To be considered a depressive episode, you need to have had 5 of the following 9 symptoms for 2 weeks, and it must be different from how you normally feel. One of the 5 symptoms must be either feeling depressed or losing interest or pleasure in things. Here are the 9 symptoms in simple terms. Number 1 is feeling depressed most of the day, nearly every day. Number 2, losing interest or pleasure in almost everything. Number 3, significant weight loss or changes in appetite. Number 4 is trouble sleeping. Number 5, feeling very sluggish or agitated. Number 6 is feeling tired or having no energy. Number 7, feeling worthless or very guilty. Number 8, trouble concentrating or making decisions. And number 9, having thoughts of death or suicide. These symptoms also need to cause significant problems in your life, like at work, school, or in your relationships. There are also other things to rule out, but in general, it means that the depression isn't caused by something else. Depression can be mild, moderate, or severe. Don't worry if this is hard to understand. Basically, depression can look like not enjoying things you used to, trouble sleeping, not taking care of yourself, and more. Sometimes it can make you feel like harming yourself. Major depressive disorder is more common in younger people, especially ages 18 to 29, and in women. And puberty can be a time when depression starts. Things like poverty, discrimination, and feeling excluded can contribute to depression as well. Some people experience depression almost constantly, while others have episodes that are far apart. If you have periods of high energy and intensity, like mania, you might have bipolar disorder instead of depression. I won't cover bipolar disorder in these series, but it's important to know the difference. Also, if you've had difficult childhood experiences like abuse or neglect, you're more likely to have depression. And if you have a family member with depression, you're also more likely to have it. So that's all for today. Your homework for this module is to journal for 10 minutes about what you learned in this video. What stuck with you? I look forward to seeing you in the next video.